me go through the questions. The first one, the second one, I scroll down. The first one is from Marika Geldenhuis. She says, apologies because she may have missed it, but are the 3,000 whole SARS-2 genomes publicly available and accessible? And where can they be accessed if they are? Over to you.
Yes, that is a condition of the funding, is that the information should be publicly available. I do not have the specific website now, but I will make it available to Yancy. But if you go onto the CRISP website and then go to the NGS component, Network for Genomic Surveillance, you will actually find all the links then to the databases as such. So it is, we made sure it's actually, before they make it available, all the information is uploaded.
Great, thank you. The next question is from Everest Umbatsumbu. She says, great presentation and congratulations for the initiative. It's something that's really needed in South Africa. So she has two main questions. The first question is, did your drug research discovery, sorry, a really loud bus is about to come past. Sorry. Okay, okay, there we go. Did your drug research discovery use a multidisciplinary approach for the COVID-19 treatment on a national level? Was it a combined work in terms of pharmaceutical and in traditional / indigenous treatment? So that's the first question. So over to you.
The funding that we provide for the discovery for the African digital medicines, that is being managed by one of my colleagues, Dr. Ank Shabalala, and that is within the IKS component of us. The other projects that we were funding is the clinical trials, or still is ongoing clinical trials around existing drug and the repurposing of existing drugs as such. So it's not drug discovery as such. So it's two components within the department as such.
Right, thank you very much. And her second question, this is Everest again. She says, is there any possibility of doing a comparison study of the vaccine efficacy in percentage against COVID-19? Vaccine versus a negative patient, vaccine versus a COVID-19, someone who's contracted COVID-19, the interactions, vaccine versus a patient with both the virus, that has the virus in terms of the new variant, the vaccine versus a negative patient who's diabetic, a vaccine versus a negative patient who has TB, and a vaccine versus a negative patient who has HIV. So the question again, is there any possibility of doing a comparison study? And she lists various examples.
If you look at the data for the J&J trial, I think it is either today released or it will be released tomorrow, where you've got the more full data set for the J&J vaccine. A lot of that was worked into it already. But what is happening is the rollout of the Johnson & Johnson vaccine in South Africa is actually falls under the umbrella of a 3B clinical trial. So those specific questions is being followed up right through it as part of the rollout of the vaccine. As when we do get other vaccines that we foresee, we might be able to get other vaccines as well. Similarly, the surveillance will be done for those vaccines. We are in the process of developing the protocols for post-rollout surveillance of the vaccines to understand what is happening and what are the effects, but also then what's the long-term effect of those vaccines, to what extent, to what do they provide immunity on a long-term basis or not? For the one question that we still need to ask is whether we will need to be vaccinated on an annual basis like with a flu vaccine. We don't know yet. And so that is part of the ongoing surveillance that we are busy designing on the moment as such.
Debbie speaking here. I think I'm specifically looking, because I'm going to be working on the media release, I'm specifically looking for common themes. And what became very clear is that there were lessons learned. There were many of the same lessons that were learned, which is very positive, because it reinforces that there are valid lessons to be learned. That's number one. So I thought that was very valuable. The one missing point, which I didn't seem to get, and maybe it was done out of polite reasons or political reasons, is that we all know once something becomes, where there's so many points which need to be coordinated, and so many parts of this massive framework that needs to happen, is I'm not quite sure where the challenges on an organizational level, whether those were brought out clearly. I mean, there was a general note of a lack of implementation, but nothing really specifically said. And I think that there are lessons to be learned there more and more, especially with the technology that we're getting used to. We're understanding how to collaborate and not to be so competitive against different bodies. And I felt that there could be a lot more discussion around that on that kind of organizational level. Where are the challenges and where can we improve in that way? And those are my points, so thank you.
Thank you, Debbie. Would either one of the three ladies who have addressed us this afternoon like to answer that question?
I can make a tentative comment. One of the things I think we don't have enough of is coordination between different sectors. You know, we've heard today a great deal from different parts of this whole system that we have. And I don't see it all coming together sufficiently. And I think that would be very helpful. I don't know that we had really got it organized when this whole thing started. We have had a year though, and if we are looking, as the theme of this meeting is about preparing for the future, I think there is room for more effective cooperation and coordination and communication between the different role players. And I think that is something that would help.
Thank you, Stephanie. There's just a remark from Dr. Esper Ngube. It was a wonderful session, especially the main lesson that all sectors need to work together, as diseases are multidisciplinary in nature and need collaboration across sectors. So that is similar to what you are saying. I certainly agree with that. Quite often in our discussion forums, we've seen that things fall down because of a lack of cooperation. There needs to be sufficient collaboration and partnerships within the system for it to work. For me, it's still distressing that we have actually quite excellent policies at national level, legislation, strategies, even collaborations and coordinations. And yet that doesn't filter down to the local government level or to community level. And I'm not sure how one even begins to fix that. It seems to me more than a governance issue. It's almost like people from the ground up need to get involved in initiatives so that they also have a sense of having a stake and an interest in what is done and what should happen. Does anyone have a thought on that?
It's Claudina here. To me, one of the problems that is sort of really that we need to find a way forward is that you do have different health systems in the different provinces, and each province do its own thing, and there's not, they're trying to coordinate it, but when it comes from the sort of head office in the province down to the actual district level, that is where a lot of things actually go wrong. And I think what COVID has done, it's really demonstrating all the pain points that we do have in the health system. And we unfortunately, yeah, we need to make sure that we do not perpetuate these problems going forward. But when you start looking at the implementation from the National Health Insurance, to what extent are you actually going to address these problems that came out now? And to what can we create a really coherent system across the country? Thanks.
Right, thank you. Yes, these issues are very concerning, and it seems to me that we haven't really learned how we can address these things. But we've learned, like you say, about the pain points, and the pandemic has really exposed the cracks in our society and in our systems. So it would be wonderful to find ways of addressing that, but maybe we need a follow-up session to get people to come and talk about public governance and local governance in particular. It's unfortunately, that's more of a political issue.
I don't think, sorry, Yancy, I don't think it's only a political issue, but on the moment, your decision makers is so overwhelmed. It is such an immense problem that you don't really have time to go and sit and say, how do we solve it? It is sort of, we've got a problem, how do we solve it now? Not what will be the long-term effect and how to solve it long-term. And at this stage of we were getting there, and then the second wave hit us. And so it's still in panic stations to a certain extent. And now the vaccine panic stations, how do we get these vaccines out? And only later, when the wave is now going down, vaccinations are starting to happen. Now people can start reflecting on what now? How do we go forward? What do we do now? So we first have to get through the storming area of before you can get to the real planning going forward.
Point taken. It's indeed, it's very difficult it's very easy to underestimate the amount of work that has been done in the past year. It's only a year. It's incredibly short time. And I suppose even having a discussion forum at the end of that year is to say we're at a space where we can actually start looking at preparation for the future. But I think you're right. There are limitations to how much we can consider right now in terms of preparing for the future. However, I'm very glad that government is in full swing, getting its hands dirty, being fully involved in what needs to be done and in how to solve problems. I think it's impressive, actually. Right, anything else?
Can I make a quick last comment, Nancy?
Yes, please.
This is one sentence. The message that we heard right a little while ago from Dr. Peter Johnston about climate change and the fact that we could have inserted climate change into and replaced the word pandemic with climate change all the way through my presentation. I think we should note that. It was such a clear message, and it's so correct. And I think that's something to just flag. Thank you.
Right. I don't know if everyone saw that, but there was the comment that we can replace COVID-19 with climate change throughout Prof. Burton's presentation. and it would still hold true. So the issue of public communication when you're dealing with an enormous crisis, the same principles actually hold true. Indeed, they do. And I suppose people will start listening when they start feeling the effects of climate change as being disastrous, just like we are now more open to listening now that the public health situation is a crisis. Okay, I think we are wrapping up this meeting. It's been a very rich conversation, very thought-provoking, and thank you very much to all the speakers who have shared their substantial knowledge and insights and experience with us today. It does give me a feeling that we have a lot to be proud of as the science sector in South Africa and as South Africa. And it's so often hard to see that and hear it because of all the noise, especially the negative noise around in social groups, on social media, in the news. It's apparently bad news travels further than good news, much quicker. So it is really good to see these things in better perspective and not to be, what can I say, beguiled, misled by the negative headline to begin with. So thank you.